Sexually transmitted infections are either bacterial or viral illnesses that can be passed from one person to another through sexual contact. Some of its symptoms include itching, discharge from the private parts, abdominal pain, and a burning sensation when urinating. These signs and symptoms are the body's way of fighting off the infection.
Once an infection is detected by the body, it mounts an arm against that infection. And during that fight, some collaterals, which we call the damages, which you may see pass, that either the immune system is defeating the organisms, or the organisms are defeating the immune system, and you start discharging these discharges that we see.
But not all sexually transmitted infections have symptoms. Infections like chlamydia and human papillomavirus have been described as silent killers because they show no signs. Contracting such diseases poses a serious problem for HIV-positive patients because of their low immunity.
And the reduced immunity exposes them to acquisition, but also delays the clearance because they don't mount enough army to clear the organisms from their body. So the organisms will stay longer in their systems.
Dr. Othman Kakaire is a consultant, gynecology and obstetrician working at Mulago Hospital. He carried out research in 2013 to find out whether there is need to introduce new screening mechanism to detect STIs in HIV-positive women.
So we use the laboratory test, which is very quick and sensitive in that you can get the results on the same day. We call them the polymerase chain reaction, PCR. That's that we are able to detect gonorrhea, chlamydia, and trichomonas vaginalis, which are the commonest STIs in this part, in the world actually.
His findings show that 11 of every 100 women living with HIV have sexually transmitted infections that don't manifest any signs or symptoms. The study was conducted among 351 women. The absence of symptoms does not necessarily mean that the infection is mild.
On the other hand, you may remain asymptomatic, but the infection may continue and cause severe complications. Things like a complete or partial blockage of the tubes, leading to infertility or ectopic pregnancies.
When a lady that is suffering from this STI that has no symptoms decides to take on a family planning method, especially that which involves insertion, the infection might spread to other organs in the body. I met this lady, whose identity I won't disclose, at the Family Health Clinic of the Directorate of Obstetrics and Gynecology at Mulago Hospital. She says she has been treating an STI for long without much success.
The abdomen and the discomfort, the general weakness, and the weird feverish that comes almost daily. Still there, you can feel it.
Dr. Kakaire says her condition might have gotten worse because she initially had no symptoms, which in turn made her fail to treat the infection early. Several other women with similar conditions were in the queue waiting for Dr. Kakaire to treat them. The doctor is now writing a policy brief to be presented to the Ministry of Health on how health workers can best screen HIV-positive women for STIs.
We are going to work with the ministry and give them this information. And then we see how we make a policy for it, policy guideline for the family, for health workers to see how best can they screen for sexually transmitted infections in people coming for family planning, especially those who are HIV positive. Yeah.
Although the study targeted HIV-positive women, its findings indicate that even women who are HIV negative can suffer adverse effects from sexually transmitted infections that have no symptoms. Irene Namyalo, NTV.